It is important to know that PTSD is treatable. And that's really the most important message here, is that PTSD is treatable. Hi, I'm Idit Albert. I'm a clinical psychologist, and I have been working in the area of trauma and PTSD for many years. PTSD is really a disorder of vivid memory, vivid memories of the traumatic experiences. Individuals re-experience in involuntary way distressing memories of what happened, and that includes the emotions, but it also includes the kind of the sensory experience of the trauma in flashbacks, of the sight, the sounds, the smells, the tastes of the experience of the trauma. It tends to be that kind of during a threatening, dangerous situation, people need to really focus their attention on the most dangerous part of the experience. And that sort of strengthens the memory of that experience. And that's the part that people tend to re-experience. So often if you get, for example, somebody who's been in an armed robbery, they'll be able to remember the details of the weapon, but probably less likely to remember what the perpetrators were wearing. Understandably, because these experiences, re-experiencing of these memories are very distressing, people try and really steer away from anything that reminds them of what happened, whether it is conversations about it, places, activities, anything that trigger the memories of the experience. And for some people it could be quite an obvious thing, like a news item about an assault when they've been assaulted. But sometimes it could be something like innocuous as kind of blue skies, because at the day of the trauma it was a sunny, beautiful day. So these things are very sort of personal. People also tend to be much more kind of hyper-vigilant to danger and to threat, and more easily startled, monitoring the environment. And these experiences, these symptoms affect their day-to-day, their ability to connect with others, work, studies, and function. The main cause for post-traumatic stress disorder is a traumatic experience, a very distressful, stressful, life-threatening experience. Often these experiences unpredictable and uncontrollable. There could be lots of different types of traumatic experiences that cause PTSD. They tend to be the threat, perceived threat or actual harm, physical harm or sexual harm to ourselves, or if we witness it happening to somebody else, or if we hear that these things happen to somebody close to us, as well as loss of lives. People tend to develop PTSD more in relation to interpersonal trauma, so when they feel that somebody else had the intent to harm them. So therefore people are more likely to develop PTSD to assaults, combat, more than to accident and natural disasters. There's also differences between single incidents, and sometimes people suffer from repeated, prolonged traumatic experiences. And people tend to develop PTSD more in relation to repeated experiences. If people had experienced traumatic experiences when they were young, suffered physical or sexual abuse or emotional abuse, they're more likely to develop PTSD. We can't exactly predict who will develop PTSD, and there are different risk factors and also resilient factors. We know that how people, their experiences during the trauma can affect whether they'll develop PTSD, and also what happens afterwards. So when people receive really good support afterwards, it can mitigate the development of PTSD. It's also how people perceive their experiences afterwards, and whether they blame themselves for what happened. That can also affect whether they develop PTSD. And also whether they have other stresses following the trauma, physical health problems, financial problems, problems with employers or with their education or with their relationships with others. That can also cause further stress and development of PTSD. There's also, of course, an element of our unique personalities and how people manage stresses. People who find it easier to talk with others and seek support are more likely to manage it better than people who tend to kind of keep to themselves. But the important thing, of course, is that people don't blame themselves for the development of PTSD. It is the way they respond to often abnormal situations and stresses. So if a person who've had a traumatic experience, finding that they are suffering from re-experiencing intrusive memories and emotions in relation to the trauma, and they're finding themselves persistently avoiding certain activities, places, things that reminds them of the trauma, and that they're generally more hypervigilant, alert, more easily startled, and having difficulty sleeping, then they're probably having the clinical symptoms of PTSD. And what would really be recommended is that they talk to their GP or their doctor, and that they talk to a mental health practitioner who are trained to diagnose post-traumatic stress disorder, and that they have the diagnosis. So of course, for somebody who is in a situation of threat, of harm, the most important thing is to remove themselves from harm or to minimize harm. So if you or somebody close to you are in a situation which is traumatic, but there's still a risk of harm, the important thing is really first thing to make sure that the person is as safe as possible. And often that requires discussions with different agencies, depending on what is the situation and what help they can get. But the important thing is that people are first safe. I mean, obviously it is important to access treatment, but of course there are things that people can do to help themselves manage the day-to-day difficulties. One of the things that helps is to try and remain active when possible. Some activities will be more difficult, but people will find them quite frightening, but where possible, that the activities that they're still able to engage with and enjoy, to engage with those. The other thing is really to use our senses of vision, sounds, smells, taste, touch, to try and keep and feel grounded in the here and now and enjoy the experiences that are around us. NICE, the National Institution for Clinical Excellence, recommends that people who are diagnosed with post-traumatic stress disorder receive trauma-focused cognitive behavioral therapies, or eye movement desensitization and reprocessing, which is called EMDR. Both treatments, what they do is they focus on the traumatic memories, elaborate and process the memories, the emotions, the meanings that people have that make them feel that they are still suffering from ongoing risk, and help people to overcome avoidance and to be able to function better in their day-to-day lives.